So our lecture today is the end-stage renal disease. As we know that the kidneys are responsible for many functions, such as regulation of the acid base of the plasma, control of the fluid volume, and also the fluid electrolyte balance, and also filtration of the blood from waste products, nitrogenous waste products or non-proteinous waste products. So filtration of blood from the waste product is the main function actually of the kidney. In addition to endocrine function, the endocrine function includes the secretion of the hormone erythropoietin, which is very important to stimulate bone marrow for production of the red blood cells, and also the secretion of renin, which is also involved in the regulation of the blood pressure. Also, kidneys might be involved in the synthesis of the precursor of vitamin D. So functions in general have two main functions, which is metabolic or endocrine functions. As we know that the kidney consists of nephrons, or the basic unit of the kidneys are nephrons. And there are millions of nephrons within each kidney. These nephrons consist of structures such as glomerulus, and also there are tubules, which is either proximal convoluted tubules or distal convoluted tubules in addition to other structure. And also there are blood vessels, or what we call vasculature of the kidney. So actually nephrons and the vasculature of the kidneys can be affected by certain conditions such as hypertension, diabetes mellitus, systemic lupus erythematosus, and so on. Under these circumstances, and if the nephrons of the kidney affected by these conditions, this will lead to damage or destruction of these nephrons. So actually, if there is destruction in the nephrons, usually there is hypertrophy of the other nephrons. I mean, one of the nephrons destructed, the other nephrons undergoes hypertrophy. This is to compensate for the destructed nephrons in order to make the function of the kidney normal. So actually, this depends on the percentage of the nephrons destructed. So if for example, the percent of the nephrons destructed below 50% of the total number of total percent of the nephrons of the kidney, in this case, if it is below 50%, in this case, the other nephrons might compensate, might be undergo hypertrophy to compensate for the function for the destructed nephrons. So the function of the kidney can be what we call, there is some disturbances in the function of the kidney, but usually the patient looks normal. And some investigation or some laboratory investigation might be abnormalities. So this condition, it is called renal insufficiency, and this is the first stage of end-stage renal disease. So the first stage of the end-stage renal disease is the renal insufficiency, in which there is destruction of the nephrons below 50%, and there is hypertrophy of the other nephrons to compensate for the destructed nephrons, and usually there is, or the patient looks normal, there is no clinical manifestation, but laboratory investigation might indicate some abnormalities. If there is a progression in the destruction of the nephrons and more than 50% or more than 75% of the nephrons destructed, in this case, the kidney might lose its function. So in this case, the condition is called uremic syndrome because there is more urea within the blood, and also called renal failure or chronic renal failure, or also we can say this is the end-stage renal disease. Actually, in case of uremic syndrome, there is azotemia, an increase in the blood urea nitrogen, which is non-proteinous nitrogenous waste product. So the first stage is renal insufficiency, and the progression in this section, it is called uremic syndrome or end-stage renal disease. In this condition, I mean, in case of chronic renal failure, there is decrease in the glomerular filtration rate. The functions of the kidney, filtration of blood, and this is through the glomerular filtration rate, decreased to 15 ml per minute. So in this case, the patient present with many clinical manifestations, and these clinical manifestations may involve many systems of the body, such as gastrointestinal, cardiovascular, hematologic, and so on. So if the patient, for example, in case of GIT involvement, may complain of anorexia, nausea, vomiting. With cardiovascular, the patient may suffer from increase in the blood pressure, or what we call pitting edema within the legs, or periorbital edema around the eye. Actually, there is increase in the blood pressure because the kidney lost its function, so there is fluid overload, and this will affect the blood, and this will lead to an increase in the blood pressure. Hematological, the patient may present with anemia because there is decrease in the endocrine function of the kidney. There is no erythropoietin production, there is no stimulation of the bone marrow, and there is decrease in the number of the red blood cells, and this will lead to anemia. Or the patient may complain of bleeding tendencies. This is because abnormalities in the function of the platelets, or decrease in the number of the platelets, or even affecting the abnormalities of the coagulation factors. So the patient present with bleeding tendency. Also, the patient may be fatigued or weak, and also sometimes confusion, as well as to another clinical manifestation such as shortness of breathing, or shortness of breath, and also depressed in the cough. So all of these, actually, we can see the clinical manifestation of end-stage renal disease may affect many systems of the body. So the laboratory investigation, actually the aim of the laboratory investigation is to check the functions of the kidney. The functions of the kidney, endocrine or metabolic. And this is through urinolysis to check whether there is protein within urine or in the urine, because actually normally there is no protein within urine. But in case of disturbances in the function of the kidney, could be seen protein within the urine. The glomerular filtration rate, actually this gives more indicative or more relevant to indicate the functions of the kidney. And this could be checked by serum creatinine. Serum creatinine actually is more specific to measure the glomerular filtration rate. And also we have blood urea nitrogen. Blood urea nitrogen can be used to check the functions of the kidney, but it's not specific to measure the glomerular filtration rate. So usually the physician or urologist use serum creatinine to measure the glomerular filtration rates and also the functions of the kidney. But blood urea nitrogen could be used to check the functions of the kidney, but not specific for the glomerular filtration rate. The value of the serum creatinine ranges between 0.6 to 1.20 milligram, and the value of the blood urea nitrogen ranges between 120 to 130 milligram per deciliter. Actually, there is another investigation, for example, to measure the measurement of the sodium and also potassium may indicate the function of the kidney. The medical treatment of the patient with end-stage renal disease could be conservative treatment, medications, or dietary modification to decrease the sodium in the diet, or even proteins. And actually, the aim or the goal of conservative treatment is to decrease the progressive destruction of the nephrons. This is in order to keep or to maintain the function of the kidney. Or could be treated by dialysis. Dialysis, there are two ways, either by hemodialysis or peritoneal dialysis. In hemodialysis, the patient should be plugged to machine. Actually, there is dialysis by definition is the artificial artificial filtration of the blood. And either this is by hemodialysis, that means by plunking the patient to a machine by creation of arteriovenous fistula, and plunking the patient to a machine. The machine will filter the blood. This is artificial filtration of the blood because the function lost their function. Or by peritoneal dialysis, and this is by using the peritoneum. Actually, this is in order to filter the blood. Now, dental management of patient with end-stage renal disease. So there are two ways, either under conservative care or under conservative treatment, or dialysis, hemodialysis, or peritoneal dialysis. So now we are going to discuss dental management of patient with end-stage renal disease who underwent what we call conservative care. First of all, consultation with physician. As I mentioned before, that the patient